Dental implants have been used for thousands of years. In fact, one of the oldest recorded implants was 4,000 years ago in China, where they used carved bamboo pegs to replace missing teeth. Dental implants have come a long way and are more accessible than ever with zygomatic implants. First, we'll ask Dr. Haroon, what are zygomatic implants and why would you need them? Then, we'll jump over to Dr. Neilsen, who will break down a case study of an actual patient that he has who's going to be receiving zygomatic implants. Let's get into it.
Before we talk about zygomatic implants, I'm sure you want to know what a traditional all-on-4 and all-on-6 surgery is. An all-on-4 procedure was a procedure that was designed for patients who have either lost a lot of teeth or have severely decayed teeth or have lost a lot of bone and gum tissue around their teeth because of periodontal disease.
Periodontal disease, also called gum disease, is a serious gum infection that damages the soft tissue and without treatment can destroy the bone that supports your teeth, causing teeth to loosen and even fall out.
In those cases, the surgeons elect to place either 4 or 6 dental implants to provide a fixed prosthesis, which is both functional and aesthetic. Zygomatic implants came into play in the late 1990s, and they were for patients who had lost their teeth for a long period of time. And in those cases, they didn't have enough bone to place the traditional dental implants. Zygomatic implants obtain the strength and the stability from the zygomatic bone, which is also known as your cheekbone. And this allows the surgeon to place either 2 or 4 implants and then provide a fixed prosthesis for patients who are missing a lot of bone. And this fixed prosthesis is as functional and as aesthetic as a fixed all-on-4 and all-on-6 procedure.
Now that we know what zygomatic implants are, let's visit Dr. Neilsen as he shares the details of one of his recent patients who received zygomatic implants.
Immediately looking at her case, she had been in an upper denture for so long, she'd lost a lot of the bone that she needed in order to get a full fix. So we had to do something a little bit different on her. We had to place zygomatic implants. And the reason for that is because you could look right here. So this view right here is the same as this, but it's a slice through where the back, where we would normally like to put back implants. But as you can see, this is just big empty space in these sinuses. She did not have the bone to be able to do what is our standard way of placing implants, and that's very common for patients to come in, want this procedure, and not be able to get it because of needing a more extensive work done because they just don't have enough bone. But here at Nuvia, we have other techniques, and we're able to help almost everybody. There's very few people who we wouldn't be able to help, and Della's one of them that we were able to. She has nice big cheekbones up here that we're able to place the zygomatic implants in instead of using what she didn't have the bone down here. And then on the upper, she was able to get 2 implants in front, and then also the zygomatic implants to get that extra support, because we really want a minimum of 4 implants per arch, and she's able to get that. And so let me show you her post-op X-ray.
Make sure to hit that like button and subscribe, as well as click on the notification bell so you'll know when we drop new informative videos.
Here's Della's post-op X-ray, and as you can see, the lower, we were able to save 2 of her previous implants, add 2 more, and then hook them up to the lower set of teeth. On the upper, she actually just needed 1 zygomatic implant, and we were able to find enough bone and do some slight, move implants at some different angles, and that's a big benefit when doing this procedure, is that you don't have to think of placing teeth the same way you do when you're doing single tooth implants. When you're doing single tooth implants, you want to replace, you have to pretty much place the implant right where the previous tooth was. When you have a full arch to work with, you're able to angle the implants. We're able to get the best bone that we can, and we make up for that angulation by putting in angled abutments. And so that even though, you know, these implants are placed at different angles, and then here's that big zygomatic implant, to maximize the amount of bone, the good bone around the implants, even though we're angling these, we were able to straighten out those angles with the proper abutments. So if you were to look in her mouth, if we were to take these the teeth out and look in her mouth, all the abutments would be completely straight and vertical, like they were all perfectly straight implants, and so the teeth just fit right on there. And thanks to being able to do this big zygomatic implant in there, we were able to get the bone retention that we needed to for those implants and to get a successful procedure. And Della's been very happy with the results, and she looks great, and she's able to eat food she hasn't eaten for many years.
If you have any other questions about dental implants or procedures, comment below and we will source your answer from the professionals.
Thanks for watching. Want to know if you're eligible for Nuvia's permanent teeth in 24 hours? Take the 60-second quiz right here and find out now. And if you'd like to watch another video like the one you just experienced, click that thumbnail right there and keep watching.